More and more, we're starting to see mental health being treated like physical health, and more people are getting comfortable talking about this issue, which is a good thing. But there are still things that can be done, and joining me to talk about that now, we have Dr. Monica Bartoli, a family medicine physician here at Boulder Community Health. You guys have actually integrated behavioral health into your primary care practice.
Yeah, we've actually adapted a new model of care that's emerging where we have a behavioral health specialist in the office with us. And that is enabling us to kind of close that gap on patient care when we identify people who may need services for depression. We now have somebody in our office so we can bridge that gap, and I think that helps with early intervention and screening.
The idea is that you intervene early and can get the person treatment, get them started on a therapy program. What does that usually look like?
So when patients come into the office, generally they're asked identifying questions, and some of those are you feeling down? Are you feeling hopeless? Have you had changes in your sleeping? And different behavior patterns, and that clues the physician in to this person is at risk.
The suicide rate in Colorado is concerning, and in this state it's very high. Among western states it tends to be a little higher, and we're seeing this problem with younger teenage suicides. What are the concerns there, and are we letting some people fall through the cracks?
I feel in recent years we have definitely let people fall through the cracks, and I think one of the biggest things we need to do is look at mental health as health and start integrating it into our practice visits, especially with adolescents. It's a very difficult topic to talk about, especially with children, but if we can identify teens and adolescents who may be at risk and get them into the right setting for help, and that's where talk therapy and cognitive therapy really comes in. We don't want to be putting kids on medications that they feel like they have to be on them their entire lives, but if we can intervene early, those kids that are falling through the cracks hopefully don't.
Is there still a stigma around having a child talking about their mental health and being aware of that?
There definitely is still a stigma, but we're trying to break that down. Like I said, looking at mental health, not just as mental health, but as health, and trying to rip that stigma away, I think is starting to help people understand it's okay to be open, it's okay to talk and be in therapy. A lot of times, especially with our younger generation, they have a hard time coping with different things, whether it's because of social media or other aspects. So I think talking about it and having a doctor and a physician talk about it helps to break that stigma down, that it's okay to have help and it's okay to be expressive.